introduced a new product in the market for the management of H. pylori. Pylobalance is an innovative product formulated in Germany. Today, we are honored to have with us Professor Dr. Christine Lang to discuss Pylobalance. Professor Dr. Christine Lang is a microbiologist by profession and the CEO of Balance GmbH. She functions as a consultant of bioeconomy for the German government and is a chairwoman for the German Bioeconomy Council. She is also the first vice president of the German Association of General and Applied Microbiology, VAAM.
So local statistics have shown that a staggering 1 in 4 Malaysians are positive for H. pylori. However, the worldwide statistics show that almost 50% of the population are positive for H. pylori. Even though there are many other treatment options available in the market, however, it comes with the danger of incomplete eradications, antibiotic resistance, and also side effects from the current treatment regime. So to overcome this gap in treatment, YSP have launched Pylobalance as a new approach in H. pylori treatment. So Professor, could you explain to us what sets this Pylobalance apart and makes it so unique?
Pylobalance is unique as it has a unique strain of Lactobacillus reuteri, and this unique strain is a patented and registered strain with a certain number, and its mechanism of action is that it has the ability to co-aggregate with the pathogen Helicobacter pylori in the stomach. And this is a quite unique and very efficient method to bind Helicobacter pylori in the stomach and to co-aggregate it and to flush it out of the stomach, so that you efficiently reduce the load of Helicobacter in the stomach of a patient.
Professor, there was a mention that Pylobalance is a non-viable strain of Lactobacillus reuteri. There have been questions regarding this statement as probiotics require live bacteria to function. With a non-viable bacterial content, how does Pylobalance work and what are its advantages?
Yeah, it's correct. The strain that is in Pylobalance has non-viable cells. When we selected this strain in our lab, we were of course working with viable cells, and we recognized that the ability of Lactobacillus reuteri strain to connect to a Helicobacter pylori is associated with a certain protein molecule on the surface. And we patented this recognition mechanism, and also we patented a process that says you can inactivate the cells, so you have non-viable state, but you keep the activity on the cell surface. So having a stabilized strain and cells in the Pylobalance product means that you still have the activity to co-aggregate with Helicobacter pylori, but you don't need a viable cell for that.
So based on your experience, Professor, what kind of gastrointestinal issues that are commonly linked with H. pylori that can be treated by this Pylobalance?
The most common issues with Helicobacter pylori are gastritis and duodenal cancer or ulcers. But first, when you have Helicobacter pylori, it may well be that you only see an abdominal pain, or you have nausea or vomiting and dyspepsia, mild dyspepsia. These are the first symptoms of Helicobacter pylori, and not yet an ulcer. But both kind of conditions would be accessible to Pylobalance.
Okay, are there any other gastrointestinal issues that is not caused by H. pylori, but it can be, Pylobalance can also be effectively used if it's not related to H. pylori?
The thing is that both H. pylori gastritis, but also other gastritis that is not caused by pylori, is an inflammatory process.
Okay.
And Pylobalance or Pylobas strain also acts as an anti-inflammatory agent. So it could well be used also for other gastritis symptoms.
From a medical practitioner's point of interest, why should he or she consider including Pylobalance in the treatment of H. pylori, and can Pylobalance be used as a standalone for the eradication of H. pylori?
As Pylobalance has a different mode of action than antibiotic standard treatment, it is a very good and excellent addition to standard antibiotic treatment because it shows that in clinical studies data have shown that at adding Pylobalance, the strain that is in Pylobalance, adding it to a standard therapy increases the eradication rate and the efficiency. It also helps to reduce side effects. And to the question if it can be used as a standalone therapy, that is a very interesting aspect, as we have seen study data that show if you use Pylobalance strain Pylopass as a monotherapy, you also get eradication.
I see. You have mentioned that Pylobalance is useful in prevention of H. pylori infection. How so, and for how long should it be taken?
H. pylori can be transmitted orally, so in a family or from mother to child or father to child. And of course, in that case, it would also be very interesting to have something that can be used as a prevention. So when you use Pylobalance in that, Pylopass strain can also reduce any Helicobacter pylori that gets into your body by infection. And so you can use it as a kind of prevention and precautionary treatment. This should work very fast, but we see data in our clinical studies that we use it for, it's been used for 2 weeks, 14 days, up to 28 days, and we have even seen 56 days. But let's say a 2-week cure up to a 4-week cure would be a good way to start prevention.
Okay, so Professor, can this Pylobalance be used in children as well? And if yes, how young is the age that we can actually start the course of this Pylobalance with them?
This is mainly a question of regulation in the
Yeah.
country. So in many countries it's said that children below 7 should be treated separately, or in a different case. In Europe it's the case children below 4 years are regarded as a separate group. We have ourselves seen in studies that children till 9 years have no negative effects but have been positively used in this. It needs also to be mentioned that we've never in any of our studies seen any side effects, negative side effects, so neither in children nor in adults. And I just like to mention that Lactobacillus reuteri strains have previously been used also in children for health reasons as a probiotic. So I don't see any, I personally do not see any regulatory issues.
So what about pregnancy moms? Is it also safe to be consumed during pregnancy?
We do not see any data that contraindicate with pregnancy.
Okay. Thank you.
Professor Christine, I understand that the recommended duration for a full course of Pylobalance is once daily dosing for 30 days. Can this duration be shortened, say 2 Pylobalance capsules for a day for 15 days, or is there a maximum daily dose? Would there be any effect on the effectiveness of Pylobalance?
We see in some studies that indeed you can reduce the time to 2 weeks and taking kind of a double dose of the recommended. We've seen for a longer time, and there have been no side effects either. Currently, clinical studies are on their way to monitor the effect of even higher dosing.
I see. Are there any side effects of Pylobalance that the medical practitioner should look out for?
There are indeed no side effects mentioned. We've never had a report on any adverse effects in the clinical studies, so we don't see any reason to warn against side effects.
That's very encouraging to know. For our last question, are you aware a patient on standard therapy has to wait for a minimum of 14 days after finishing the course to confirm the eradication of H. pylori with UBT? Is the same true for patients on a course of Pylobalance?
We have indeed not tested anything and to get a diagnosis earlier, because that is the routine diagnosis that a doctor would do. But actually it should probably be able to test it at a very early period after the cure, because we do not have to wait for urease bacteria growing up again after an antibiotic therapy. So it's a different kind of treatment, so it might be possible also to use a shorter period. Up to now we have only seen the standard diagnosis tools tested.
So that is the last question for our interview session today. So it's been an honor to have you, Doctor, with us. And is there any last word that you would like to share with everyone?
Thank you for having me here, and I'm happy that now also in Malaysia doctors will be able to use this new
Yes.
therapeutic tool for patients that may not want or need antibiotic therapy.
Okay.
Thank you very
Thank you so much,
much.
everyone.
Thank you.